This is the Emergency Medical Minute, sponsored by Health One. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
Okay, so we'll do a quick medical minute about not opioids. So yay, you guys are probably all happy. What we're actually going to talk about, which is sepsis. Okay, so what's the most important thing with sepsis? It's a very broad, open-ended question. Antibiotics, pressure, recognizing it early. Great. Finding the source. Okay, all of these are really important. I'm going to actually say the most important thing about sepsis is time, right? This is an extremely time-sensitive disease. So the most important thing is time to recognition, time to fluids, time to antibiotics, and the new one is time to pressors. Okay, so this is a disease that, you know, if you don't recognize it early and you let people languish and don't get good source control, or let people be hypotensive, that they're just going to do poorly, that they're going to end up with end-stage organ failure, and they're just going to die. So what you do in the room as a nurse and as a physician really matters, right? If you recognize it and we say, hey, we need to give 30 mLs per kg, your goal should be, let's try to get that in as quickly as possible. So it's large bores IV, it's 2 of them, and it's pressure bags, so that you can get as much fluid in that patient as possible to tell us afterwards, do we need to do the next step? And what is the next step if they're still hypotensive? If they're still hypotensive after 30 mLs per kg, the next step is pressors. Great. So norepinephrine is the preferred pressor. And there's now a study that shows if you start it early, you decrease short-term mortality by a pretty significant amount in septic shock. So if you have a person with, let's say, septic shock, their mortality in the next, I think it's 1 to 2 months, is around 34%. And if you give early pressors and get them out of hypotension early, you'll decrease that to 21%. So you're talking a pretty significant decrease, right? 10% decrease in mortality. The thing that all you guys should put in your back pocket is, how do you need to start pressors? You don't need a central line. Right? So as soon as you recognize someone's still hypotensive, go ahead and start low dose Levophed in their IV, and you can tell us and we'll put a central line in for you, so that we can go higher on the dosage. But anytime you recognize that initial resuscitation hasn't resolved the hypotension, you should be putting in a pressor via the peripheral line that you've already placed. Okay? Last thing we know, time to antibiotics saves lives, so we give ceftriaxone early, and that's it on sepsis. A disease of time.
So if you enjoy our show and are able to make a one-time or recurring donation to help cover our operational costs, any amount is helpful in making this show possible. Click the link in our show notes to make a donation. Thank you.